So in your screen, for example, for me, I noticed some I don't know how to say. Yeah, case-wise. Okay. Is anything related to earlier symptoms, something going to happen, or what should be definition of that?
You had the mammogram, and they classify you as you had the calcification. Usually that more related to the density.
That's like density, yes.
So you probably, I would say, your doctor maybe ask you to follow up.
Right, monitor the breast. Yes. Every, every 6 months or every year? Every 6 months, yes. That's normal.
They may ask you to get the 3D too.
Yeah,
If
3D,
yeah.
I just had the 3D. Like I said, the 3D, it's less, it presses the breast also, but it's less painful. And it slices, when they take the picture, the scan of the breast, it shows the tissue in slice, like the whole breast, and they slice it. So they have a better view of seeing any abnormality into the breast, especially if you have density, a dense breast. I also have dense breast. So there's always question, yeah.
But for you, you don't feel any, right? Yeah. If it get bigger, they probably.
And you have little cysts that they see on the. Okay, yeah, that is important to keep an eye and monitor it. I have a little ring which I'm going to show you. I have a model there. This one here. You can feel. It was glued. It just came apart. It's very old. I have a bigger model that I use because I belong to a nonprofit organization. Kai-Ying and I, we work together, and one of our colleagues died 10 years ago of aggressive breast cancer. So I and her daughter and myself developed a foundation. So I have a model that I use when I go out to the community, but I was not able to retrieve it for this event. But this is one I have. So you can feel, I will place it, you can touch and feel what a lump feels like, so that you have a sense of what it's like. Yes, so when you have dense breasts, there is little lumps, little cysts that the doctor sees, and he is concerned. They measure it, and they look every 6 months. They look to see if it gets bigger. If it becomes more than 9 millimeters, then they become alarmed. Okay, so be very vigilant about it, because it can change. But also you should do genetic testing, because you don't have to have a family member who has breast cancer.
Don't be a doctor first.
Yeah. But you know what? No, today.
For consulting.
Yeah.
What's the next step?
Right. Today, people have to be aggressive. You cannot say, listen to the doctor, or the doctor, the doctor passively say, well, keep watch and see. Watch and wait. No watch and wait anymore. You empower yourself, okay? Take control of your health, because later down the road, 18 months, like Patricia said, 18 months later, she found, this. So, yes, it wasn't picked up on a mammo. So, yes, okay?
So I want to ask you, the 18 months later, like between that time, 40 years old, you didn't, because if we go cancer, maybe no issue, but the thing is, between that and 18 months, what happened?
Nothing.
Nothing?
No, we don't know.
You didn't feel any?
I think what happened because it's lobular.
Yeah.
It's a little harder to be picked up on mammogram.
Okay.
The MRIs, which is not something that the doctor
Right.
will
Normally
know
have
until they are very, very suspicious. We'll see it.
Okay.
Okay, but the lobular on, unfortunately, the mammogram is hard to pick up.
But
So I would think it's there because I was stage 3. It was a centimeters?
7 centimeters,
Yeah.
yes.
So you're saying-
It was big, it was
So,
big.
so within the 18 months, you felt something hard.
It took 18 months for me to really notice because I didn't think I was high risk
Right.
because of all the things I did, who I was,
Uh-huh.
until I felt the pain.
Oh, you got it, okay.
Yeah, I felt the pain and I'm like, wait a minute, this is not right.
Yeah,
And I went to the doctor.
Okay. Very, very quickly something.
Yeah, so something that was pretty aggressive, I think, it grew really quickly. But I did, once I turned 40, I went. It wasn't a pleasant experience, but, yeah, the mammogram,
I
but
guess
I
we
went.
don't want to request MRI, you know.
You can't,
You can, it's
Oh.
usually not gonna
it
pay.
won't pay.
So that's
Yeah, some
why
things are
it's a
covered.
good we encourage people to test yourself first. Because when you exam, you will be firm.
Uh-huh.
So hopefully you can find out, because a lot of patients came in, I usually ask the patient, how do you find out? Many of them, they say they find out by themselves.
Oh,
So some of them is by pick up by mammogram. So because mammogram, you can do the job, but at the same time, you
Yeah.
see how the little size,
Yeah.
just a visual,
Yeah,
get an
this is a
idea.
visual, okay. So mammogram can pick this one up, this little tiny one, okay? When you're doing your self-breast exam, you can feel this. This is big. Also, mammogram can pick this up. This is like a half dollar. If you have one of these, it's very big. So, yeah, so you, 9 centimeter is about, 9 millimeter, yeah, millimeter. It's about this size, okay?
that millimeter, can you feel yourself?
Yes,
Yes.
yes.
And that's what's stage.
It could be,
See, you will
inside
go
too,
by
you know,
pathology.
by pathology.
By
Yeah,
biopsy.
you will know,
don't stage it
biopsy,
by the
yeah.
size, yeah. So it could be tumors.
Yeah, it could be a
Not
benign
cancer.
tumor,
Yeah.
it could be just, yeah,
But when
benign.
you say genetic testing, you know, like say if she doesn't have family history or we don't have, then what is genetic testing will tell us?
Will tell you, you're,
To make sure you don't have.
right, you
Oh,
don't
just your
have,
family
yeah,
history.
yeah, yeah.
But genetic testing, you talk about the BRCA1 and BRCA2?
I'm sorry?
Genetic testing, you talk about BRCA1, BRCA2?
Right.
Anything else, like HER2?
HER2 positive, yes, you can do those,
ER,
yes, yeah. PR negative, and yes, those are all, biomarkers.
Okay. So positive are good, right?
Yeah.
All right, negative not good.
Right. Most breast cancers are positive. PR, are positive. The negative ones are, dangerous.
Oh, dangerous.
All 3 negatives, yes, triple negative is
Yeah,
the worst
triple
type
negative bad.
of breast cancer to have.
BRCA1, BRCA2, only the movie star you talk about.
Yeah,
mentioned that.
Angelina Jolie.
Yeah,
And
that's
she-
are the biomarkers too?
Yes,
Oh.
yes. And what she did was, she decided to remove both breasts
Remove.
because the fear of developing
Right.
breast cancer or ovarian cancer.
Okay.
And she also did the hysterectomy.
Oh, okay.
So she
Yeah.
removed all the
All the
potential
risks.
of estrogens in her body.
Okay, gotcha.
Yes.
Yeah, most of the surgical doctor at this stage, if like Patricia say, after they finish all the treatment, the breast surgery, because her stage and depends on what test. I don't know. I was the case. Down to the road, they also ask
The woman.
the woman to remove the
Ovaries.
ovary because trying to get it completely removed, reduce the risk
Of
that cancer come back.
Correct.
So which it seems the current practice and also seems it pretty positively outcome.
Yes.
And survival rate, that's why survival rate is higher in this day. So yeah, so we see a lot of patients coming in they don't have problem here, but it's prevented to have a problem. And we also had young women come in here, like she said, the movie star, she came in here had them removed and have this surgery because she positive from the gene study. So she knew she gonna have it down the road.
Down the road,
And
yes.
sister have it, and then she just get it done before
Take it all
even
out.
positive cancer. So that's an individual choice.
So like the movie star, she got the gene testing beforehand. So you talk about when you get breast cancer, you better get gene testing.
You should have,
But
you should.
but maybe even before you get cancer, you better get gene testing.
Well, no, because the
No?
insurance will cover it, unless you're gonna pay out of pocket.
How?
Yeah.
I mean, there's a
No, they won't pay
lab
for it.
test you can do.
Yeah,
Right?
insurance will not pay for it. It's very
Yeah.
expensive.
Very
As-
expensive.
I'm hopefully in the next few years, 5 years, it will be common, common practice. When you go for your physical, you get blood work, you get a genetic testing.
How expensive?
I really don't know, because I didn't, that's a good question, I did
Yeah,
not look it up.
it's worthy. I mean, not too much, right?
Yeah, well, years ago, doctors would discourage it, but now it's so commonplace, you should advocate for it, because really, people are developing these rare types of cancers, and colon cancer, prostate cancer, all that, they are doing different genetic testing.
Yeah, I know. They all have different biomarkers, so
Yeah,
you
biomarkers,
cannot cover
correct.
them all.
Correct.
Yeah.
Can you tell me if it's one side will be completely other side or it's both side or something?
You mean the breast?
Yeah.
Oh, well, if you have it in one breast, sometimes it can go, and if you have the dense breast, yeah, it can be bilateral, but usually it's unilateral, meaning it's on one side. Yes.
Yeah, so just keep it following.
Yeah, just very, very vigilant. Keep an eye, because it can convert anytime.